Namaste everyone. Welcome to the monthly Gitananda Integrative Therapies Academy Awareness Program, where we all gather together with new topics with different aspects like the women's health. We took the adolescent health. We also had discussed with the naturopathy, allopathy, siddha, music therapy. We have talked a lot. So in this month's awareness program, we are talking in this session about the men's health. And before we get started, we'll invoke the Guru Parampara, Guru Gayatri. ॐ तत्परम्परयाय विद्महे ज्ञानलिङ्गेश्वराय धीमहि तन्नो गुरुः प्रचोदयाते ओम योग महर्षि डॉक्टर स्वामी गीतानंद गिरी गुरु महाराज की जय। ओम पुद्वै कलमा मणि पुद्वै शक्ति योगाचारिणी अम्मा जी मीनाक्षी देवी भवनानी गुरु माता की जय। ओम श्री गुरुभ्यो नमः। हरि ओम। So I welcome you all again on this platform of Gitananda Integrative Therapies Academy. And without taking much of the time, I will just start sharing and just letting you know what we are here for. And it is a very interesting platform where we have we have an opportunity to learn something new, and it is all from this tradition. I will be sharing a screen. I think we have a message from Dr. Ananda sir, a recording, and which will help us to understand what this awareness program is all about. So hope you can see the screen. Yeah.
Namaste, Vanakkam, Swagatam. Such a pleasure to be with all of you on the occasion of this awareness program being conducted by GITA, the Gitananda Integrative Therapies Academy. I congratulate our directors, Yoga Sadhaka Anandraj Bhavanani and Yoga Sadhaki Sagalakala Valli Divyapriya Bhavanani on these initiatives. And I appreciate the dedicated efforts of our CEO, Yogacharya Nilachal, who is doing his best to take this message to all of you. Gita is based on the principle that yoga and allied therapies are the way for us as a human being to grow into our holistic potential. Physical, mental, social, emotional, spiritual, and why not also financial health is vital for every human being on this planet. We must make sure that each individual receives those therapies that are appropriate to them in the appropriate way, in the appropriate manner, by the appropriate qualified, competent people. This is why at our Gita, we are taking forward these awareness programs so that all of you can understand our mission and vision. Why are we taking this forward? To reach each and every human being who is seeking care, and not just ordinary care, but loving care that comes from a noble place in our heart. Awareness is vital for us to grow. We have to be aware of our suffering if we are to transcend it. We must be aware of our problems if we are to solve them. And of course, we must be aware of our potential if we are to grow into it. I wish the successful conduct of all these awareness programs, and I also appreciate deeply all our resource persons who are highly qualified and competent in their own field. And I thank you all for supporting Gita as we move forward step by step, doing what is possible every day, so that one day when we look back upon it, we will see that we have indeed done the impossible. Loka samasta sukhino bhavantu, sarve jana sukhino bhavantu. Om Shanti Shanti Shanti.
So this was the message that we always try to inculcate, and today in this session we may also get an opportunity to, yeah, sir. Okay, namaste,
Namaste,
sir.
namaste, namaskar. Nice to see you, Dr. Mohankrishna.
Namaste, sir. Namaste, sir. Namaste, sir.
Especially to listen to you.
I'm nervous, sir. I'm definitely nervous.
No, not at all. We are looking forward, and so please take it forward, and I'm going to enjoy it. Thank you.
Thank you.
Thank you, sir. And as we're getting started, I just want to briefly uh, tell about what this session is all about, what we're doing. I will go directly into the session and will invite our resource person, our speaker of the day. So, it is a deep joy and privilege to welcome you all in today's awareness program. As you all know, the Mindful Man, and it is for all, as many of them were asking, like, is it okay if I'm a female, I can join? So it is for all. But the topic is the mindful man. And at Gita, I like to mention about Gita. We believe that the awareness is the first step towards healing, and many challenges faced uh, today, whether physical, mental, and emotional, that arise merely from disease, but from a lack of understanding about how our lifestyle, thoughts, stress patterns, and environment shapes our health. So these awareness programs are meant for those awareness building, where our intention is not just to inform, but to gently awaken a deeper sense of responsibility towards our own well-being. We most of the time lack this awareness of our own self, and in our tradition, where Ammaji mentions that awareness of how unaware we are is of taken very utmost importance. So we need to understand that our well-being is in our own shoulder or health. So here at its foundation at Gita, it has three essential pillars: yoga as therapy, where we're using yoga as a scientific and therapeutic tool for healing that we use; yoga as education, spreading knowledge and awareness for informed living; and yoga as a way of life, integrating yogic principles into daily existence. And the approach is very integrative that we try here in this institution. While Yoga Chikitsa remains the central axis of our work, we thoughtfully integrates insights from various systems like the allopathy, naturopathy, Siddha medicine, music therapy, dance therapy, Ayurveda. So this integration is not random or superficial. It is done with sensitivity, clarity, and a clear focus on the individual, understanding that each person's need, the requirement, and his journey of healing, where the journey is completely unique for each individual. And through this awareness program, we try to outreach the people, and we try to aware people to understand different aspects of the health in different dimensions, and they can help themselves through different modalities or the health systems they can come. And in today's theme, where we can see the mindful man is both timely and essential, and in a world where men are often conditioned to suppress emotions, ignore uh, inner signals. Okay. And constantly push through this session offers a different perspective, and you must have received different kind of Google forms that you must have filled. So on the basis of that also, we are going to learn a lot, and we have with us our dear Dr. Mohan Krishnan sir, who is a dedicated clinician, academician, rehabilitation specialist, and he serves as a physiotherapist at GIPMA, and in the Department of Orthopedic Surgery, and in Jawaharlal Institute of Postgraduate Medical Education and Research, JIPMA, and with hands-on experience in orthopedics and functional rehabilitation, his work focuses on restoring movement, reducing pain, and improving quality of life through evidence-based physiotherapy practices. He is actively involved in patient care, therapeutic interventions, and interdisciplinary rehabilitation approaches. In addition to his clinical work, Dr. Mohan Krishnan sir has contributed to academics and has received international recognitions, including serving as an external examination for institutions abroad. His approach integrates scientific rehabilitation with a holistic understanding of health, making his insights especially valuable in today's discussion. And he is also my external expert in my PhD study, and I have gone through his studies, and he has many works, research works, and one of the work that he has mentioned about the neck pain that I went through starting my research study, and it was about the Brahma Mudra and how beautifully he integrates the yogic practice of Brahma Mudra, which can help to relieve the neck pain. So there are many more studies that he has done, and this is just to mention a few. Without taking much time, I would like to invite Dr. Mohan Krishnan sir to take this platform. Over to you, sir.
Namaste. Namaste to all. Thank you, nilachal. Thank you to Ananda sir. And it's a wonderful platform. Hope I'm audible and visible. My screen is visible?
Yes, sir, it is visible, sir.
Yeah. Is it changing?
Yes, it is changing.
Yeah. Okay, so I'm really grateful to the opportunity what I've been given, and I'm deeply honored to stand in front of you. Um, Greatness of Ananda sir, Meena madam, and all the team, including nilachal. Um, to be very frank, I'm the odd man out, and in the sense I'm more into clinics. I'm not a great practitioner or a teacher of yoga. I do follow some yogic concepts, but not as good as others in this August gathering. I've just tried to get the best as of the topic is concerned, and hope I justified the opportunity given by nilachal. As I start, the topic is more on men. Okay. Normally, it is being least spoken. So today I'm a little enthusiastic and a bit nervous as well, because my wife is watching from there. So I'm a little nervous, but nevertheless, I'm glad that I'm able to talk. I'm going to talk more on men. And to be thankful to everybody, the Om Gurubhyo Namaha Hari Om. This is the start point where I have started to flourish with the blessings of my family, my patients, my teachers, everybody. And thanks one and all who is going to be with me for the next 30 minutes. First of all, we should understand, not really understand, just get into the depth of what we actually mean by men's health. It is not just about some disease or some I should say some disease process which is undergoing, which an individual undergoes. It's not like that. It is about being wellness of an individual who is doing well in all his capacities. But it requires little purview where you really look into the problem of the vulnerabilities men can undergo. So that is the core point of today's issue. Like before we started this presentation, uh, Nilachal was highlighting a point, wonderful point. See, we should be aware of what we are unaware of it, as what Amaji's version goes. So this entire presentation will give you an insight of what really we have, what's the problem we have, what we are facing, how are we supposed to attend to it, and what are the ways and means of it. I'm not going to talk more on the means and the sense on the aspect of application, but on the analysis and introspection of the major concerns of men's health, the prevalence, the incidence. Today, I have taken the opportunity to analyze a few of your own health concerns by sending you a survey. Many of you have answered. Thank you. Thanks for your response. And I have tried to get some more information from people outside. So not only from this group, I've taken a few doctors, nurses, physiotherapists, common man and things like that, and they are only men. Today I'm going to summarize the analysis, the survey, and I'm a guy who always would like to talk on evidence, what is there in today's scenario, and try to understand so that it means a lot to us. So today we have a major concern as far as men's health is concerned. Like, it is predominantly the death. This resource is from WHO. So this slide gives you an insight of the major health concerns that a man can experience. The predominant death caused in men's is more than 75%, which is because of cardiovascular disease, predominantly predisposed by hypertension and high LDL, the low density cholesterol, lipoproteins, which are in your system, cardiovascular system, leading to cardiovascular disease. That is a predominant cause for death among men. The next probable cause of death among men is cancer, and which goes in the order of leading cause is the prostate. The next is your lung, followed by colorectal, and the last is your testicular cancers. So, and the next on the list is your metabolic health disease, which we are going to talk more today. And predominantly the metabolic health disease, we have this diabetes mellitus and obesity, which can lead to metabolic health disease, which is life-threatening. And the last but not the least is your liver disease. It is very common in men. The immediate possibility what we think about liver disease is like we say that we take alcohol, so alcohol leads to liver disease. But surprisingly, the present scenario shows that is non-alcoholic fatty liver disease is more predominant than the disease of the cirrhosis, which is caused because of alcoholic dependence. So that's a good news, but I'm not saying get into practice of alcohol, but the predominance of liver disease, the cirrhosis, is common among non-alcoholic individuals, predominantly because of their lifestyle, the drug habits, the prolonged chronic diseases, and the medications what they take because of metabolic health disease. So this is just to give an insight of the predominant health threats for men, and this is data which derived from WHO, just to highlight the August group. And the major concerns, if you just look in depth as far as the age group is concerned, just we start from the 20 years to 60 years. Initially, you see that it is predominantly the testicular health, the mental health is concerned. And in the middle age, usually the injuries takes over, no? Because that's where a man usually thrives for the family and tries to make money and tries to gain what not to say what all on earth. So that's where he's vulnerable for injuries and things like that. And 40s, naturally, as age starts to settle in, the incidence of cardiovascular disease, diabetes mellitus, and obesity related diseases will come. And by 50, you have to start yourself to screen for prostate. Prostate, I don't mean to say the cancer part of it, but prostate function has to be monitored. Its health has to be, maintained. Naturally, once you cross 60, what you have to really think about is your musculoskeletal system. First concern, major concern is going to be your bone density, the strength of your bone. And of course, the density of your neurons in your cortex leading to dementia and your heart status. So if you see the key focus, it's more of mental health, functional health, metabolic health, and lastly, the physical conditioning, inclusive of cognitive reconditioning. But if you overall see the tabular column, you can see it's more of a physical concern, equally concerning the mental part of the men's health. Let it be 20 or 60. The cognitive, the mental health deserves, preference has to be given to the mental health as good as to the physical health is concerned. Okay, so having said that, Let us just jump into the statistical part of it. Today, I had distributed a survey analysis among our members to understand what we are really undergoing. Okay, so majority of our people, whomever I have received the response, they have more or less symptoms of stress sometimes. Okay, and I have not seen one person saying no. Okay, so that's the highlight, that the stress occupies the major part of the concern for a man's health. Usually, the stress part of it is being spoken for the female counterpart, where the hormonal influence is adding up the fuel to the fire. But nevertheless, male also undergoes stress, and the frequency is quite high with the analysis what I could manage today. With a very little population, I cannot generalize it, but to talk practically among us, all of us are having stress, at least sometimes in a day, in a week, in a month, in a year. So none of us are exempted from stress. Okay, understood. But what is the source? As Amaji says, if you are not aware of what is the source of the stress, you cannot manage. Okay, so understanding the stress could be the major cause of the disease of men's health. You should know where the source of stress is coming. So just to introspect among ourselves, the analysis shows, you can see the graph. The top is your work. The workplace is the major predominant cause for the source of stress, followed by financial stress. And the third is a combination of both work and finance. And the interesting part is the family. And what surprises me is, like, all of us are not worried about our health. Health is going to the last place. I'm really surprised to see that. I think that should be the first one, which it should not cause stress, but health has gone to the fifth place. Of course, I have tried to highlight a lot of other sources, but they didn't carry weightage. That's also this is a source of stress among us. Okay, we know what is the stress frequency, where it came from, and how do we manage it. Most of us take rest, take sleep. Of course, I'm happy to see the second bar, that we exercise to manage the stress. And of course, interesting part is that some of us practice avoidance. We try to avoid the source of stress. Best way to handle things, that the yogi concept of just ignoring the source of stress. So this is the very nutshell picture, a concise format of the survey what I made. And this is just for an understanding sake. I've just tried to highlight, rather than just talking about an analysis or a survey which has been done in Australia or Europe or somewhere which doesn't really match to our lifestyle and things like that. And a very interesting part here. So I just try to analyze the source or the stress compared to married and unmarried person. In the analysis what we made, I'm sorry, today we got the response. The married persons are vulnerable, or they experience more stress. That is 66% more stress than unmarried guys here in this group. And to the analysis. And immediately we start to attribute, okay, the marital status is the one which has led to the source of stress. So married men have stress because of the married status. It's not like that. The analysis, a deeper insight, shows the intensity is high because of multifactorial reasons. It is not just because of marriage these married people have, because of the responsibility they carry, the commitment towards the family makes them more stressful. That is a combination of stress from the work, the finance, and the responsibility of health possibilities from them. How do they cope up? They cope up with, like everybody, but it has gotten, of course, they are worried more on the financial status of the family, because they are the responsible breadwinners of the family. So that's the reason why this married people have more stress, and not the unmarried people. So the unmarried guys in this group, don't take the message wrongly, especially nilachal. Okay, so marital status. So coming to the evidence part of it, what does evidence say? Okay, married individuals experience less stress than compared to unmarried individuals. This I'm not saying, or my survey doesn't say this. This is evidence which has been published some 10 years back, some 8, 9 years back, and they have done on cortisol levels, which was evaluated, and it says the marital status does support to manage your stress levels for when compared to unmarried individuals. Okay, that is in general, but marital status in men's health, if you observe very carefully, these people, what happens is these people experience greater reductions in perceived stress during difficult times. You see, like when you have some sort of a chronic illness or some sort of a palliative care under which you are in, these people try to cope up better when compared to unmarried individuals. That is the conditioning what they have. This is what research says. This research was done on a set of people who have advanced prostate cancer. They have been given cognitive interventional approaches, and they have observed that those people who were married were responding better to the cognitive interventions when compared to unmarried individuals. So these married people have a better edge when compared when the marital status is concerned. They have a better edge over unmarried individuals. That's why she did mention it as a difficult times. So marriage does, your partner, your spouse, your kid, children, they do support you in difficult times. So that helps you to manage really your perceived stress. So we have been talking more on stress. Of course, stress can lead to so many other things. But we need to understand men undergoes metabolic diseases. What is this metabolic? We call it as shortly METs. This metabolic stress disease is like it has a combination of diabetes, hypertension, and its related disorders. And it is characterized by obesity, and you have reduced insulin resistance, insulin resistance, and you have high cholesterol, and it has got its own negative implications on your personal and social behavior. Okay, coming on to the topic. Okay, so now we have come to the place where the source of disease to the person can be multifactorial, and predominant cause is because of mental health, well-being, which can be managed or which needs a focus or attention. So in that perspective, if we have to be a little more receptive and insightful about the causative factors and manage the vulnerabilities what a man can feel, we should practice mindfulness. This mindfulness, what happens, the research says, it reduces the development of metabolic disorders by reducing the hip waist circumference ratio, the LDL and HDL ratios, and also it reduces the blood glucose level, let it be fasting or postprandial. So mindfulness is not just a list in your prescription. It really is an intervention by itself through your mind-body interventional approaches. So metabolic disease can be well managed with mindfulness, not only with medications. Of course, it has to go hand in hand with your physician's prescription of medications and lifestyles. So you should also start to practice mindfulness to manage your metabolic disease. And so far we have been discussing about the stress involving your physiological function, reflecting on your physical health, causing metabolic disease, leading to diabetes, hypertension, obesity, etc., and liver disease, so on. But we also need to know when somebody is going to talk about men's health, the first thing what it strikes your mind is your sexual health. Of course, this is a topic where it is being less spoken about. And when I'm talking about that, I have taken the second probability. Actually, it has to be the priority when it comes to the men's health. Sexual health has to be the priority in wellness of a men's health is concerned. The definition of WHO, it goes a state of physical, emotional, mental, and social well-being in relation to sexuality. Sexuality means a normal sexual function without any dysfunction or disease-induced dysfunction. It has to have a healthy practice with adequate knowledge and without any inhibition. Okay, so that is what is all about men's sexual health is concerned. Okay, when talking about sexual health, how does it influence? Recently, I just spoke to one of my friend who is an andrologist. He is practicing in a very well-known city and is a well-known andrologist, and he is known for his specialization. He's a neurologist, and he practices such a good allopathy practice, but he is constantly in need of a person who can teach this mindfulness, yoga practices, lifestyle management interventions, cognitive behavioral approaches. He is badly in need of one because what he feels that medications, surgical interventions, along with lifestyle modifications and behavioral approaches means a lot. What he strongly believes is medications and surgical interventions alone, please take it, understand, these alone will not suffice the outcome. It will not promise your outcome. The outcome is purely dependent on individuals' understanding about the adequate knowledge about the normal sexuality and normal sexual function, sexual awareness. Okay, so in that fashion, in that perspective, mindfulness means a lot to the sexual health as far as men's health is concerned. And it is applicable in andrology, in the treatment of infertility and men's health. How does it help? It gives you sexual satisfaction. It gives you the optimal desire. The erectile function is neutralized. It's even facilitated, and better orgasm is achieved. And coming to the outcome part of it, how does this really play a role in sexual health? What evidence says is mindfulness improves your body image. It improves your self-esteem, which is very, very important in having confidence in yourself. And genital self-image is the most important of all, which is being very less spoken outside, in the sense like, no, I cannot talk so openly here, even in this August group. I cannot go into the depth because I have some inhibition, you have some inhibition. So most of us have some sort of inhibition. So I think that part has to be definitely attended to. And the mindfulness practice really has an impact on the men's sexual health, which is a priority of today's infertility scenarios concern. It holds good for female also, but men's health has more to do that because it has got its own impact on the normal sexual functions. In general, mindfulness in men promotes a good amount of mental health, improving the psychological outcomes, the quality of life, and any trauma an individual undergoes, a physical or a mental trauma. This helps in rehabilitating the individual back to normalcy faster than who doesn't practice mindfulness. So it's very important for somebody to understand the importance of practicing mindfulness, not only in well-being, but also in recovery from major illnesses or trauma or or any other psychological setbacks in the family or in the society or whatever it is. So, but here I need to highlight to the August group, like there are some barriers to sexual health. Okay, sexual health is the utmost priority, especially for the youngsters. Uh, there are so much of barriers. The first thing which comes props up, even for me to talk in front of you all, is going to be the social stigma. Yeah, okay, and I'm ashamed to talk in detail about what is genetical image or self-image, self-esteem, sexual self-esteem, things like that. And always the cultural part of it comes in front of you to stop to talk about these things. And the most important of all, even if you have a good amount of knowledge, or you are too good, no, you are not having a proper access to the right facility. Okay, you don't, you have access to all sorts of YouTube videos and high-end AI tools to understand things. But you have volumes of information, but it is not individualized. It's a generalized information for everybody. Even if you try to prompt the AI by giving your problems, it might give some possibilities or probabilities, but nevertheless, it also says consult a doctor. Don't take this as a line of management. But nobody believes it because of the cultural mistrust and the stigma, social stigma. We try to check the Google instead of going and asking an andrologist, see, this is the problem, what I have, what should I do? We never do that. We are a CEO of a company, but we never do that. So we always should, come out of that stigma, go to a doctor. There's nothing wrong in consulting an andrologist, whether you have a child, you don't have a child, you're in treatment, you don't have a treatment. It is immaterial. People are scared to walk through the OPD of urology is after marriage or before marriage or whatever age you are in. No? They think, sir, urology OPD, oh, okay. Nache, what happened? Okay. These sort of things, the stigma actually should come out of it. This sexual health is a part of like anything. So I think that part actually has to be focused upon for a men's well-being, even whatever age is discussed. Let it be 60 or 40 or 30. Okay, every age has its own importance concerned to their sexual health, and let it be for reproductive phase or for palliative phase or whatever it is. You have to really have the awareness of the insight of what you are undergoing and feeling free to go and consult the right people at the right time, in the right place. Having said that, I should be the last person in this group to talk about the yogic practices concerned with mindfulness. But nevertheless, I need to highlight and justify my teacher, Dr. Ananda, that he has always told me these are the key words, like what really mindfulness is all about. It is just to stay in the present. Okay? I'm sitting and talking to you. I'm talking to you. I'm getting the AC from above. My dog is barking. I'm talking to you. Everybody is in front of me. We are connected. I'm talking to you. You are listening to me. That's all. After this, before this, no, nothing comes in between. So the point of take-home message here in the yogic way is your dharana, the attentiveness, the dhyana, the awareness of the thing what you're attending to, and your detachment to the external stimulus, that is your bhava, and chitta vritti nirodha, quieten the mind, relax, focus, and stay in the present. That's the essence of being mindfulness. Of course, in this presentation, I've not gone into the depth of the techniques, the ways to practice. I'm not getting into that. I just managed as a clinician the prevalence, the incidents, the perspective of today's management, and what are all the vulnerabilities and the major concerns of men's health that is concerned. So I think from there you can take forward how to manage this. Oh, so having said that, thanks to one and all, thanks to GITA, Thanks to Anandaji. Thanks to Meena ma'am. And thanks Nilachal. I have taken, I think, some right time. Hope I conveyed what I'm supposed to. And now I think the floor is open for discussion. I am.
Thank you so much, sir. It was very important, and you have shared your understanding, knowledge, and experience, and it is very important at this point of time. And if you have any questions, you're most welcome to raise your hand. You can ask questions, and you can type in the chat box or raise hand. Yes, sir. We have a question from Dr. Ananda, sir. So, yes.
Sir,
First of all, thank you, Monakrishnan, for that very beautiful, short and sweet presentation. And I loved your approach of doing that small survey and talking about it. And again, it was a good example of how research can often have diametrically opposite outcomes. That your short survey showed married men have more stress, and a previous one said unmarried have more stress. So this is how research goes. But I was just thinking of asking you because we often think of men as having to bear the weight of families. This is a common attribute. So the shoulders are an area that are supposed to bear a lot of caring things. So how do you find in your own practice? Is there a difference between the way the men and the women, and especially as we are focusing on mindful men today? Whether how that is impacting, say, the shoulder, upper back, from even a physical point, we are talking of the mind, but at the body, does it also impact people?
sir, thank you, sir. Thanks for the opportunity again. And I'm really nervous to see your picture here. But nevertheless, I continue to answer, sir. Sir, I think if I'm right, I understood it right. You would like to know the difference between the gender, the precipitation of stress in the body, and how it interferes physically. Sir, as far as my little knowledge is concerned, the precipitation of stress can be, earlier it was thought it can precipitate in the spine, predominantly in the neck, and then next in the back. But it is not like that, sir. Whatever predisposing factor is there, like for example, this individual has sinusitis, and if the individual undergoes stress, okay, that actually manifests the pre-existing illness, which is more profounded in the presentation. So it is the pre-existing illness which becomes more profounded, invariably because of attributing factors and the hormonal factors. Here, what in my experience I have seen that males tend to experience it, but they express it less, which is exactly opposite to that of a female. But nowadays we see both the genders are equally good in managing stress. It all depends on their environmental factors, coping up mechanisms, and the family support. And the intensity of, or suppose a person comes with a cancer, we can see that that guy is down or very bad because he doesn't have a family support or doesn't have anybody to talk to, doesn't have any support. He may be rich, he may be having everything on earth, but at the same time, I can see a poor guy who has got a mandible cancer, who cannot eat, drink, or do anything. He's so happy. He comes to the OPD and he says, where is the canteen? What are you going to do for the canteen? He says, I want to have juice. Here, juice is good. Okay. So it depends on their mentality. It is not that what is concerned. It has got multifactorial. We cannot really attribute more of male, less of females. Nowadays, equally, it all depends on their contextual factors, and family supports means a lot, and genetical predisposal also has a word in this. So I cannot really conclude saying that men and female differ, sir. It depends on so many other factors. But what I have seen is stress as such does not, which earlier we used to believe that stress leads to and precipitates in certain areas of the body, predominantly in the spine, predominantly in the neck and the back. But of late, the research shows it would be a fatigue factor, which is coming up because of the pre-existing illness and the stress which manifests the basic issue. And if it sustains to more than 3 months, it is more profound. That's it.
Thank
Thank
you
you.
very much.
And one more question, sir. Like you mentioned about the expression, the male are not very easy to express things. Why is it so? And how is this a problem, or it can be managed, or it is natural like that? Because I have like seen my when my father, like he never used to express his feelings. He always used to do his duties. Never saw him expressing a lot. And like I also do not have that much of expressing thing, but like how is it natural to everyone, or is it something like to specific people?
Yeah, that's a delicate question to answer with in front of Meena ma'am and another colleague. See, it is usually how you are being perceived. Okay, the expression depends on the environment. If you really want to be attended, your expression depends on your thought process. So I have seen, or we have witnessed, all of us will witness that usually male counterparts will have a better way of expression by silence. But whereas in case of others, it is really in a different way. Not all are the same. Like no, everybody has got their own style of expression. So the expression can be different ways. I'm not trying to justify or rationalize the expression part of it, but predominantly we have seen guys not expressing when they try to say, "Come on, no, this shoulder is hurting me, but nevertheless I continue." Today I had a patient, a VAP patient, who had a shoulder pain. He was having so much of pain in taking his mobile from his pocket, but he was refusing to attend it to. Like, maybe he had some commitment or he didn't have time to complain and get treated or so. It has got multifactorial reasons, but you cannot really reason out why they don't express. And it depends on people to people. But we see predominantly guys expresses their pain less than the female counterparts. So by saying, I don't know, I'm safe.
So, sir, just to follow-up question with that, does it has to do anything with the hormonal secretions that is differs from male and female with the expression, or is it like
Yeah, that's a fantastic question. Suppose, for example, you take patellofemoral pain syndrome. This is a condition where it doesn't have any real pathology to cause knee pain, but it hurts a female's knee when they get down the stairs or climb up the stairs. If you do a clinical evaluation, you'll find that it is painful, but you will not have a definitive etiology. There is no pathophysiology for development of patellofemoral pain, but this is predominant in females, and that is being sensitized by the hormonal factors, which you can see in a middle-aged girl or a lady, especially before a period. That is called as premenstrual syndrome. That time, the hormonal sensitivity, hormonal influence can influence their sensitivity. They'll have higher perception of pain, and that can predispose. Now, you can naturally see after the periods, they'll get back to normalcy and things like that. So it all depends on their body image and the hormonal factors. As long as it is well balanced, understood, it doesn't cause trouble. If it is not being monitored or understood, it tends to cause issues. You're right. Hormone does have an influence on the pain perception and presentation.
one more question, sir. So at different age, I'm just talking about the husband and wife relationship. At the 20s, 30s, 40s, 50s, and 60s, do their relationships changes over a period of time? And if like she was mentioning about that it changes, uh, and why it changes, I wanted to ask, sir.
For nilachal, I'll answer your question, but before that, I'll ask: are you likely to get married shortly?
Sir, how to
Oh,
answer this question, sir?
no, very simple. Yes or no. That's all.
Now I'm confused, sir. Like how Niruddha is
See,
also mentioning it.
see,
So
I think,
I want to know if you give the answer, then it can give you more clarity, sir. That's I'm asking, sir.
how much of a clarity I give you, you will not be clear until and otherwise you experience, undergo, and come out of it. Okay. Life is all about experience. I think I have a lot of seniors here who are married and who can have a better word about, because I cannot talk in front of them about the relationship of husband and wife as far as age is concerned. I think Meena madam is there, Ananda sir is there. They are my seniors who can have a better. Yes, I think Meena madam has got some answer for it. Yes, madam. Madam, you're muted. Nilachal.
And I just typed it out into the chat box. As you grow older, the romantic relationship matures, you mellow down, and both parties, as you grow old, it is more the companionship and the friendship which develops rather than anything else. But 30s, 40s, there will be complaints, there will be lot of tiffs, but every time you come out of it, the relationship gets stronger. And it is bound to be. If not, if there's no spice in life, things become very monotonous. So congratulations, Mohana Krishnan, because you dealt with a topic. I joined in out of curiosity. You had said like powerful men. So what is Mohana Krishnan going to talk about? Powerful men. You pulled through quite convincingly. And like Sir said, I just loved that survey that you had conducted. And it's wonderful. And the other thing is like, as you people were discussing, the women, men, like Mona Krishnan kept on telling that it is all equal, right? Nowadays, there's no discrimination, like it depends one on situation, the way every individual is brought up. Sometimes the woman has to bear the brunt of the whole family and, get exposed to things. So she becomes more like the man of the family or other way around. So it again, apart from your hormonal plays and all that, there's a situation, there's a, you live your life. It is not just dream, right? It is practical living. So what you are exposed to, what is your situation, you have to live your life means there are so many things which also matters. So being a man, being a woman, it's not just a bunch of hormones or that is not what life is all about. It's more practicality and where you are, what you have been through, and the situational, the environmental factors. It's not just a single factor; it is multifactorial. So everything tunes the person as you grow older. Sometimes for the better, sometimes for the worse. But with all these teachings, I'm sure you mellow down and you grow into something more mature where you start understanding what is the reality, not just in your life, but everybody around you. One look, you just talk to them and you understand what goes behind. So I think it's more the experience and the way you have brought up. And I don't know whether all of you will agree. Again, perspectives differ. What it is, uh, in a few more years, you will understand all this. You're still young now. Like once you get married, most of these questions will be answered to you.
Yeah, I could see Nilachal was getting restless as you continued to talk, and I started to continue to explain. I saw his body language. He was getting a little restless. He started scratching his hairless head. And he was little restless. I saw that. Nilachal, Meena madam has. I would like to align with Meena madam here. No, no. Why I'm telling you this is what she has spoken is. I should say. I should. It's really it like makes a lot of sense. In the sense, I think most of the members here will agree to me. 15 years back, when I took my PhD topic, you know what was the extraneous variable which I fixed? Females. Why? Hormones. Why? That can influence the pain perception and presentation. But after the thesis is over, after 5 years of my PhD, 10 years of my PhD, I see what is the important thing which influences the pain perception? The commitment of that person towards the family. If he is or she is the breadwinner, she does, they don't mind what they have. Okay, they just carry on, they just get to that act of making money and making their family to survive. And we have seen commitment keeps people more, their life longer, especially in palliative care. You go and see those people who don't have relation, who don't have commitment, doesn't have people to love and talk. They don't want to live and they die fast. Okay. And those people who want to live. Now, my father-in-law, for example, he had a liver cancer. He wanted to have his 80th ceremony being celebrated in a grand manner. எனக்கு சதாபிஷேகம் நடக்கணும். Okay. It was celebrated in a grand way. After that, he was very happy. Within 3 months, he died. I'm not saying he wanted to die. Okay. The commitment towards something, no, it will keep you alive. This commitment to whether it is a male or a female, or it doesn't matter. Nowadays, you have got the third gender also coming into play. You should understand that nowadays, you see a transgender. I'm sorry to use this word. This third gender is an IAS officer and a police officer, tahsildar, XYZ position. How do you categorize them? How do you treat them? They do well, but it all depends on your commitment, Nilachal. What demand you have at home will keep you healthier, will keep you more on move, on your toes. I think most of the senior members here will understand. And there was a question from Nirupara Sharma, ma'am. Yeah. Namaste, madam. Yes, I do have mood swings. Yeah, I do agree. Every man will have, and nowadays, openly people will agree for andropause. Okay. Earlier, menopause was the commonest term. Sir, idupu valli, sir, what is your age? 45. Menopause abdi irukkum po. Okay. I'm sorry to use this local language. That's how we manage. Nowadays, even guys will say, sir, yeah, menopause, get lost. Andropause, get lost. See, this passage of your normal sexual life leads to something which can have some impact, but you should understand, respect it, irrespective of the gender, and you have to attend to it, how it has to be attended. And the best part is to manage your own self. All the slides which I made now is pertaining to like what I should say, like it has to pertain to your own understanding about the issue. It is not whether you have diabetes or hypertension. It all depends on how you manage it. If you want to manage it, if you want to survive and make your kids survive, you will lead a quality life because your kids need to survive. I'm taking a lot of time. I'm sorry. This topic is getting interesting. I know this will get more interesting. I've reduced the slides as far as the survey is concerned. I was trying to highlight the source, the coping up mechanism, and the percentage of stress what our people had. So to answer Neeru madam, we do have mood swings. It depends on thing. And again, there is one thing which everybody will understand and accept it. Even Meena madam will also understand and accept it. It all depends on, if you have somebody to listen, you can talk, you can shout, you can express your anguish. But if you don't have a person to receive or address or to hear to you, you don't do that. So again, it depends on the receiving end, not only on the giving end.
Thank you, sir. Thank you for this beautiful answer, sir. And thank you for answering my question also, sir. Now I have a lot of more questions, and as tomorrow I was thinking of going to Ananda sir for some thesis work, and I will ask him more questions. So I have taken 15 minutes. Now I'll need an hour for some discussion.
Good. About marriage or for this topic?
We'll see, sir. So
There's nothing cookbook recipe for everything. It is all individualized. The same one thing what it holds good for me will not hold good for you, and has to be individualized. It has to be
Very
experienced. It has to be experienced.
true, sir. Uh, Over to Ananda sir. Ananda sir, if you are there, we want to hear final words before closing today's session, sir.
Yeah. I have been enjoying this discussion. I think it's been very spicy and upbeat. And actually, I think in modern times, the gender differences in health-related issues has become very less. Because again, the workloads have become very similar, the attitudes have become similar, the challenges have become similar. So I think we are coming to a neutral point from the point of health, other than, the actual anatomical differences between male and female and the disorders related to that. If you talk about depression, if you talk about anxiety, if you talk about, cardiovascular disease, today I don't think there's a much difference when it comes to gender. I think this is a very pertinent point. And again, I think the point that Mohan Krishnan brought out was very good that, you know, it's not the cancer, it is not the end of life situation, it is not the diagnosis, but what you feel is important for you and how important you feel where you are. When you feel you're important and you are needed where you are, you want to stay alive, you want to manage things better. Now, whether that is a positive quality or not, I have my own doubts about it because I think some of us think that we have to be Atlas and hold up the whole globe. And sometimes we need to let others also carry their own weight because by us doing it all the time, are we taking away from others the opportunity for them to grow? Because as a father, I think this is a big challenge that we have. And I think as men grow into becoming a husband, a father, an uncle, a brother in law, a grandfather, as these responsibilities come, the danger is that we want to do it for our loved ones. Now, us wanting to do it for the loved ones is very noble, but are we reducing the individuality, the independence of our loved ones by doing it for them? This is a question we need to ask ourselves. And this is why we should help others, we should do what we need to do, but also let the other person have that independence to grow through that activity. Especially, I find this in many Indian households, though it is different now, where the girls are not given the same financial autonomy as, say, the boys. So the girl grows up not knowing how to manage finances as much as the boy. When I'm talking of finances, I mean the external world finances. Now it is changing. And I believe that we have to empower each individual that way and not say that, okay, I will keep doing it for you till you get married and you have children and you become a grandmother or a grandfather, whatever be the gender. I think here it is important to realize that part of us taking responsibility for others is empowering others to take responsibility for themselves. And I think if we grow into that, that mindful men title for today will become very mindful. That be mindful that it is not just you who has to do it. You have to empower others to do it for themselves. But be there for people who need the support, but don't become the crutch. I think, using a crutch to learn how to come back to mobility is very useful. But don't use that crutch for the rest of your life. Use that crutch to learn how to stand on your own feet. And once you can stand on your own feet, that crutch can be put in the side wall for the next person who needs it. I think this is a very important thing that men mindfully need to learn is when to stand up to be counted and when to sit down to be counted so that others can also stand up. These are just a few thoughts I wanted to share today. And thank you, Nilachal, for the topic, for inviting Dr. Mona Krishnan, and giving all of us this wonderful opportunity for this knowledge sharing. Thank you so much.
Thank you, sir. Thanks a lot.
Thank you, sir. So we'll close today's session and uh, yeah, so we will try to plan some more sessions and more interactive, and we'll bring Mohan Krishna sir again with a new topic and new discussion. So we'll chant the Shanti Mantra. Thank you everyone for joining. Om. Loka samasta sukhino bhavantu sarve janaha sukhino bhavantu. Om shanti shanti shanti. Om. Thank you everyone. Thank you
Thank
Anand.
you. Thank you.
Thank you
Thank
for
you. Thank you.
joining.
You all. Thanks.
Namaste.
Thank you.
Thank you so much, sir. Thank you, Nilachal ji, and thank you, Geeta. It was a nice session. Had a very nice session. Thank you.
Thank you.